Tom Uno, the Associate Director at Institute for Human Development at Northern Arizona University, conducted an interview on October 9th with Andy Imparato, the Executive Director of the Association of University Centers on Disabilities. The AUCD is made up of 125 national network centers around the country and territories, 67 of which are University Centers of Excellence in Developmental Disabilities, 43 Leadership Education in Neurodevelopment and Related Disabilities, also known as LENS, and 15 Intellectual and Developmental Disability Research Centers.
So Andy, for the listeners, could you share some background on what you do?
Sure. So I'm trained as a disability civil rights lawyer, and I've been in my role at AUCD for 2 years. I just celebrated my 2-year anniversary as the executive director. And before that, I was the disability policy director for Senator Tom Harkin, who was the chair of the U.S. Senate Committee on Health, Education, Labor, and Pensions. I've been in Washington for about 22 years and spent about 9 of those years working in the government and the rest of the time working in the nonprofit world. For 11 years, I was the president and CEO of the American Association of People with Disabilities in D.C.
Oh, thank you. I'm going to dive right into the questions I have for you this afternoon. As the executive director of the AUCD, that you've been there in that position now for 2 years, like you said, what is your impression of the network? Could you respond to your feelings and thoughts of USEDS, LENS, and IDDRCs individually and then collectively as a network?
Sure. This visit to Northern Arizona University is my 43rd site visit for a USED, and you all are connected to the Arizona LEND as well. And I visited about 37 of the 43 LEND programs. And I visited about 7 of the 15 intellectual and developmental disability research centers. So my impression of the network overall is that it's an amazing resource with capacity in every state and territory, and there's nothing like it on this scale in the disability field. So I feel very blessed to be able to lead the network, try to represent the interests of the network, and to try to grow the network in my role as the executive director of the Network Association in Washington. The LEND programs for me were a new thing. I didn't really understand what a LEND program was before I started interviewing for this job, and then ultimately got selected for it. One way I like to think about the LEND program is, there are about 3,000 long-term trainees a year, and I think of that as we're organizing people early in their careers with a deep understanding of how to work in interdisciplinary teams to make the world better for children and families, and ultimately for adults with lifelong or early childhood onset disabilities. And I just think that's a really exciting thing, the fact that OTs and PTs and psychologists and special educators and family leaders and self-advocate leaders are all learning together about how to be leaders, how to lead teams, how to understand and impact public policy. It's a service to the whole disability field, and I think it's a shame that the rest of the disability community doesn't know more about the LEND program, because I think it's something that we should all be excited about. And I've been inspired by the trainees that I've met. From a diversity perspective, the early career professionals in our network oftentimes better reflect the diversity of the communities we serve than some of the senior leaders in our network. So I see them as the future leaders of our network, and I'm excited to see, that we're going to be becoming more diverse over time. The USEDs to me are interesting in their diversity. They were created in the last bill that President Kennedy signed, and I think the vision was to tap into the capacity of universities to develop new evidence, to share that evidence, and to train professionals, and to kind of be out there in the community making the world a better place for children and adults, initially with intellectual and developmental disabilities, and then over time many of the USEDs have pursued funding streams like assistive technology, like you have here at Northern Arizona, that bring you into relationship with the broader disability community. So to me, the USEDS are a research and development arm for the disability field, not just in the United States, but around the world. And it is interesting to me to see how many of our USEDS have built partnerships in other countries. I just came from New Mexico. They have a partnership with India where they're communicating using distance technology about once a month. And the world is getting smaller, and I think the expertise and capacity of this network is of greater interest to the rest of the world than it was 20 years ago, in part because so many countries are trying to implement the UN Convention on the Rights of People with Disabilities and learn from the US experience with the ADA and other laws in our country. And then the IDDRCs, I mean, that's really my steepest learning curve. Those folks are real hardcore scientists. Sometimes I don't understand them when they talk science, but I'm also trying to help them talk about what they do in ways that people like me can understand them, because I think it can build a greater level of understanding and support for the importance of the work that they do. I think one of the misconceptions a lot of people in the disability community have when they hear scientists doing medical research, they assume that all they're doing is trying to cure us or eliminate disability from the gene pool or from the face of the planet. And that has not been my experience as I go around and visit the centers. A lot of the work they're doing is trying to improve the quality of medical interventions so that they can be more tailored to the needs of the individual. So understanding the genetic makeup of the individual, how it interacts with certain therapies and interventions can result in less side effects and can result in better delivery of medical services. So, I mean, for me, the IDDRCs are kind of the NIH heavy part of the network. The USEDS their home is the Administration for Community Living now, and the LEND program's home is the Maternal and Child Health Bureau as part of the Health Resource Service Administrations. And all three networks seem to have relationships with the Centers for Disease Control and Prevention. So those four kind of homes within the Department of Health and Human Services are kind of the lifeblood of our network. But the bottom line for me is, as a lawyer, who's not an academic and who's worked in the disability field at the national level for over 20 years, I'm embarrassed at how little I knew about this network when I started this job, and I'm very inspired by the potential of this network to reach even more people. And I would say if I have one big goal as the executive director, it's for more people who could benefit from our expertise to find it and know how to access it.
I think you already addressed my next question, and that was going to be, what is your vision for this network?
Yeah, I mean, there's a lot of ways to talk about the network. It's a $650 million network with capacity in every state and territory. I believe that if we pursue a wider range of funding sources, we could be $1 billion network with more capacity in every state and territory and stronger relationships across the globe. I'm very intrigued by the idea that we could have a network of university centers in Australia, a network of university centers in Japan and in other countries. And I don't think we should try to run all of those networks, but having relationships with them, having exchange programs with them, and helping the disability field writ large see the power of this model as a force for change all over the world. That's exciting to me because there are universities all over the world that I think would be excited to be part of a network like this in their own countries.
Going on to my next question. I know your background is in policy. What do you see as the major policy developments out on the horizon for us?
Yeah, I mean, that's been a big question this year. Part of it, we're in a presidential election cycle. Part of it, we just celebrated these milestone anniversaries for ADA and the special education law and Medicaid. And I would say one of our big policy challenges is to better align the vision of our civil rights laws like the ADA, IDEA, the Developmental Disabilities Assistance and Bill of Rights Act with laws like Medicaid and the Social Security Act. If we can get our long-term services and supports programs to have high expectations for people with disabilities and to provide the kinds of supports that will help people with disabilities move into the middle class and participate in the labor force at a much greater level, I feel like our whole field can move to the next level. One of the ways to frame what our agenda is nationally, I think we want to see more people with disabilities moving into the middle class. We don't want to see such a strong correlation between disability and poverty. And I think one way to get there is to get serious about our entitlement programs and looking for ways to remove disincentives for people to have higher wages and disincentives for people to save money and buy a house and do other things that other people take for granted as they're trying to be successful in the middle class.
Thank you. What do you see as the major challenges as we move down the road?
Yeah, it was
The
interesting.
policy.
I spoke at the Southwest Disability Conference yesterday on a panel with Haben Gurma, who's this phenomenal young lawyer, a deaf-blind lawyer who went to Harvard Law School, and Jim Parker, who's a kind of an elder leader in New Mexico, who's been doing this work for a long time, who's active with ADAPT, has been arrested, protesting disability. So we kind of had three generations of disability perspective on the panel. I'm 50, Jim's 70. I don't know how old Haben is, but she's probably around close to 30. And I guess from my perspective, we got asked the question from Tony Cahill, who was our moderator. What is your biggest disappointment 25 years after the ADA? Which is actually how he started the panel, which was kind of a downer. But I told him, and I hadn't really thought of it. I mean, sometimes things come into my mind, but I told him my biggest disappointment is that Justin Dart, who I think was the most effective leader we've had as a field, died in 2003. And when I came to Washington in 1993, I felt a sense of hope and excitement about the future. We had just passed the Americans with Disabilities Act. That was a big deal. We had all these Clinton appointees with disabilities who were authentic leaders from our field, who had these big jobs, assistant secretary for special ed and rehabilitative services. We were kind of feeling like we were coming into our own as a community. And I feel like I don't feel the same sense of excitement right now. I feel like in some ways we're struggling to find a leader or a group of leaders like Justin Dart who can help bring us together across all of our different categories of disabilities, service providers, professionals, self-advocates, family leaders. Justin had a way of seeing a role for everyone and making everyone feel like they were important. And I feel like we don't have enough leaders like that at the national level right now. So, the way I would frame that in response to your question of challenges, I feel like one of our challenges is to get back that sense of excitement and optimism and hope, that sense that we are powerful, and the sense that we are working together, and we will work together to build on the progress that we've made over the last 25 years.
What an eloquent way of putting it. Totally agree with you. What do you consider your major accomplishment to date for the network?
Yeah, I mean, there's different ways to answer that. I feel like this network is very big, very complicated, and very diverse. So one of my biggest accomplishments is just getting out there and spending time with people in the network. And I'm particularly proud when I visit a center like the one at Minot State in North Dakota, and they tell me they've never had a visit from anybody in the AUCD central office. So I hope that I've been sending the message to the folks in the network that what they're doing on the ground is more important to me than what's happening in Washington, and I want to get out there and spend time with them so I have a better understanding of it and I can explain it better to people in Washington and around the country. At the staff level, I'm very proud of some of our new hires that have come on board since I started. The person who I think has been particularly exciting for me is Michael Gamble McCormick, who used to run our University Center for Excellence in Delaware and was a Kennedy Fellow with Senator Harkin and then became policy leader for Senator Harkin. Michael is a rare person who understands the network, understands higher education, understands public policy, and can really build a strong bridge between our network and policymakers. I have the understanding of policy. I don't have the depth of understanding of the network that Michael has or of higher education.
Not yet.
Yeah, I'm working on it. But at any rate, so I'm happy that we were able to recruit Michael. The reason we were able to do that was a grant that we've competed for successfully to provide technical assistance to all of the Promise grantees around the country who are testing interventions for children on SSI and their families to try to help them get better outcomes as adults. So, I would say the budget has grown from about 3 million to 5 million. We've brought on some new kind of high impact staff. Our staff has become a lot more racially and ethnically diverse. We've brought on new staff with disabilities. We've empowered existing staff in different ways. So I think there is a sense of excitement and commitment in the central office that is palpable, and I have fun going to work every day and working with a very motivated team. And there are little things that I'm proud of. I'm proud of the fact that we had 300 proposals for the conference this year, and we had 240 last year. So that's a pretty big jump. I'm proud of the fact that we had 11 people who wanted to run for our board of directors this year, which people tell me is kind of a record. So it seems like there are people in the network that are motivated, excited, energized, want to be part of the national organization, and I think that's a good place to be.
Where would you like to see the network in 10 years?
I think we have some strategic goals that were framed initially as 2-year goals, but I think some of those goals are not likely to change over the next 10 years. So I think it's useful to answer your question by referencing the goals. So one of our goals is to expand our visibility and reach. In 10 years, whether our name is AUCD or it's something else, and we'll have to have a conversation about what's the best name to describe all of the stuff that goes on in our network, I want our name to be more of a household name. I want policymakers, when they're doing anything that touches the lives of children or adults with disabilities, to want to ask the question, well, where is AUCD on this? Like they might ask the question, where is AARP on this if they're thinking about elders? I'd like for classroom teachers and parents to be able to come to our website and get information in formats that are very useful and usable for them. And I'd like for us to be able to point to things that have happened over the 10 years between now and then, where they're big game changers for children and adults with disabilities, and AUCD played a leadership role in helping making those things happen. Another goal that we have is impacting policy and practice. I think the game changer, reflects that goal as well. Another goal is to tie the network together better as a network. And if you think about 10 years from now, I've never counted the number of FTEs, full-time employees that exist in the network, but I'm going to guess we have at least 6,000. So what I want to do using technology is to connect those 6,000 people with each other in much deeper ways than they are right now. I want somebody who's doing autism screening in the U.S. Virgin Islands to be connected with somebody doing autism screening in Guam, and somebody doing autism screening in inner city Chicago, and somebody doing autism screening in Sitka, Alaska. And I feel like we can do that with technology, but we've kind of scratched the surface. I feel like there's so much more we can do to create clusters of excellence throughout our network around the different issues that we work on. We have a goal around diversifying our funding. If in 10 years, if we could bring in another couple $100 million from new sources, I think that would be a good goal. And we have a goal around diversity, and I know, Tom, this is something you personally have spent a lot of time on. I want our directors to reflect the diversity of the communities that we serve. I want our board of directors to reflect the diversity of the communities that we serve. And I want the disability community to own us as their organization, to really see us as universities that are doing good work in service of and in partnership with the authentic leaders in the disability community.
What are your thoughts about marketing the network, its resources, its expertise to the country?
Yeah, I think in 2015 and beyond, a lot of that is about how we present ourselves online, because most people are going to find us online, whether they're a journalist, whether they're a policymaker, whether they're a parent, a teacher, a self-advocate, a professional. And I think it starts with our website at the central office as a portal to then find the websites of all of our individual centers. When we designed our website, we designed it primarily as a resource for the network. And what we're trying to do is pivot and really view the website primarily as a resource for the public. And if it's a resource for the public, you can't list Lend on the website and expect people to know what Lend is. I mean, you really have to think about, how do I describe what we do in a way where somebody who's not part of us would understand it? So we have some work to do there. I think we need to be on television more as a network. We need to be writing op-eds more as a network. We need to be investing more in communications as a network, and recognizing that the research we do, the evidence that we develop, the training that we do is only as good as our capacity to get the implications of it out to people who know what to do with it and are motivated to use it. And in my world, that boils down to communications. We have to package what we know in a way that people know what it means and know how to access it.
Couple more questions. What would you say to the young person thinking about entering a career in disabilities?
Well, it's interesting. I graduated law school in 1990, and I graduated from Stanford Law School. I had very good academic credentials, and I had a lot of opportunities, and I ended up going into disability as a career. And I've had a lot of people over the course of my career say to me, you could have done so many other things. You could have made a lot more money. Why did you go into disability? Don't you find it limiting? And, I always answer that question. First of all, this was not an altruistic thing on my part. It was a hedonistic thing on my part. I love what I do. There's nothing altruistic about it. I would not want to be doing anything else. I find the disability field an unlimited field. It touches so many things. There's always more to learn. I mean, just from a policy standpoint, disability brings you into civil rights. It brings you into bioethics. It brings you into education, healthcare, transportation, housing. It's, emergency preparedness. It's hard for me to imagine an issue where there isn't a disability piece to it. So I don't see it as limiting. I see it as a prism through which to approach lots of different topics and try to bring a value system that can help whatever the area is do a better job of thinking about all forms of human diversity. I mean, our field at its best is about the idea that disability is a natural part of the human experience, and we're trying to correct for the basic human failings that have gone on for centuries, where we've undervalued or ignored or killed people with disabilities because we didn't see disability as a natural part of the human experience.
My follow-up question to you is, what would you say to families that have a person with a disability?
What I would say is, don't rely on the government to meet the needs of your child and your family without you there telling the government what to do. So we did a study on federal enforcement of the special education law when I was at the National Council on Disability, and we looked at federal enforcement of lots of other disability civil rights laws. But my takeaway from all these studies is it's not really the federal government that enforces the civil rights requirements. It's the people in the protected class. So the people who enforce IDEA for children with disabilities are well-educated, well-informed parents who are not afraid to advocate for their child. And hopefully they're doing the advocacy in a strategic way. They're working with the school as a partner and helping the school get better. But I think the most important thing you can say to a young parent who's adjusting to their status as the parent of a child with a disability is you have a responsibility as a parent to know your rights, know your child's rights, and to be able to assert those rights when they're not being met by the different systems that your child interacts with. And then as your child gets older, whatever their disability is, trying to help them be as effective a self-advocate as they can be, and try to help them be comfortable in their own skin as a youth and a young adult with a disability, so they can go into the world not ashamed of their identity or their status, but proud of their identity and their status as a person with a disability.
My last question to you is, what question did you want me to ask you that I didn't?
That's a hard one. I guess I'll close with. I'd like to go back to talk about Justin Dart a little bit. I don't want to be maudlin about it, but to me, Justin Dart was the closest thing we've had to a Martin Luther King for the disability field. He had a kind of a fascinating personal history that brought him to becoming, from being kind of a spoiled heir to a drug family to being, an internationally, known civil rights and human rights activist. But Cornel West says that in order to lead people, you have to love people. And in order to save people, you have to serve people. And Justin is the leader of all the people that I've had the privilege to work with. He's the leader that embodied those, qualities better than anybody that I've ever met. He had the ability to, if he was talking to you, you felt loved, you felt like you were important to him and to the disability movement, and you wanted to be around him, you wanted to work with him. And so for me, I'm hoping that, through all the leadership work that we're doing as a network, we can identify the future Justin Darts and cultivate them from early in their careers and help our field get to another level that's grounded in love and service, which to me are the two most important qualities for any leader.
Well, that ends our interview, and I want to really thank you for spending time with us here in Flagstaff, visiting our programs. Like North Dakota, I think you are the first Central Office Association executive to come visit us. So I want to thank you again for your time. And I know you have a plane to catch, driving 2.5 hours to the airport, so safe trip.
Thank you. It's been an honor to be here with you. I look forward to coming back.
Thank you.